The federal government announced it's ramping up vaccine distribution as the number of coronavirus cases in the U.S. climbs past 25 million. Global cases topped 100 million Tuesday. President Biden says shipments of vaccine dosages to states will increase by more than 15% starting next week.
We will increase overall weekly vaccination distributions to states, tribes, and territories from 8.6 million doses to a minimum of 10 million doses. Starting next week, that's an increase of 1.4 million doses per week.
Officials are rushing to get more Americans the shot as new variants of the virus begin straining healthcare systems abroad. A highly contagious mutation first discovered in Brazil has now been detected in Minnesota. The state's health department says it was found in a patient who traveled to Brazil earlier this month. For more on this, let's bring in Caroline Chen. She's a healthcare reporter for ProPublica. Caroline, welcome. It's really good to have you. As someone who has extensively covered the vaccine rollout, is the president's goal to increase vaccinations past 1 million a day realistic?
I think it is a realistic goal because even in the last week, we've been over an average of 1 million doses a day already. And so to continue at this pace, you know, he had originally said to have 100 million doses for 100 days, which would be at 1 million doses a day, would essentially be to continue the pace that we're already at. And really, we need to be ramping up the pace, not just keeping it steady. So I think for him to up the goal is totally reasonable.
Well, as we mentioned, the variant of COVID-19 first detected in Brazil has been found in Minnesota. What are the main concerns about that mutation?
I think the concerns with any variant, whether it is the one from Brazil or, of course, we've all heard about the UK variant by now, is one, whether it's going to be more transmissible, and two, of course, the big concern with any variant is that it be more severe in the disease that it gives you. Now, we don't have any solid evidence, so there is concern, particularly with the UK variant, that it could cause more severe disease. But either way, if a variant is more transmissible, that means that it's going to lead to more cases. And if your hospital is already strained and there are more cases, that means resources are going to be stretched more thin. And that could mean that if you do end up being very sick, that you get less quality care. So no matter what the case is, the bottom line is that you don't want to get sick. The other thing I would remind all the listeners of is that you don't want to get COVID, no matter whether it is with a regular case or with one of the variants, because when you get a case, you're basically giving the virus more chances to mutate and to create more variants that could possibly move away from the types that we have now, which so far we know that the vaccine works against. So basically more cases means more chances for mutations, more chances for a coronavirus to turn into something that the vaccine does not work against.
So I just want to make sure I understand, Caroline. So is it correct to say that these new virus variants may be more contagious, but it's not clear yet whether they're more deadly? Is that right?
Yes, there are concerns about the UK variant. There are some signs pointing towards that, but it's not yet totally well, finalized with the data that we have on hand. Because, of course, when as I said, there are more cases, hospitals become more overwhelmed, outcomes can become worse. So it's sometimes hard to see perfectly clearly in the available scientific data whether the variant itself is causing more severe disease. But either way, we really want to be very careful and not give it a chance to become more severe. For now, we think that the vaccines work against all the variants that we are aware of, and we want to keep it that way.
Okay, so on that point, so there's also the variant first detected in South Africa. That one, as I understand it, has not been found here in the U.S. So how could that variant potentially impact the efficacy of existing vaccines?
Again, so far, we don't have a reason to believe that the South Africa variant does not work with the vaccine does not work against the South Africa variant. We want to keep it that way. And again, the way we are able to pick up on these cases depends on the cases being found and then being sequenced. And not every case in the U.S., far from every case, in fact, is sequenced. So we do not know for sure how many cases we have, for example, in the U.S. that have the UK variant. We happen to be able to pick up this one with the Brazil variant. Genomic surveillance in the U.S. is something that could definitely be improved to have more visibility, more sharing of data at the nationwide level. And so these are all things that we, as a country, both need to improve on at a federal level, but at an individual level, we need to continue to do our best to reduce cases while we wait for the vaccine rollout to really have its effect. It's going to take months, frankly, for the vaccine rollout to really have the effect that we want it to have. And in the meantime, we have to continue to do everything that we can to keep case counts as low as possible.
Now, also in the meantime, there is some positive news on the antibody front. What can you tell us about Regeneron's experimental antibody cocktail?
Yeah, so I'm sure a lot of people remember these antibody cocktails, both Regeneron and Eli Lilly's, which are drug cocktails which were originally used as therapeutics. Designed and tested as therapeutics for people who already have COVID and who have been diagnosed as positive. So Regeneron just announced that its antibody cocktail was able to reduce coronavirus infections in people when it was used as a preventative. And in fact, Eli Lilly had also said last week that its antibody drug could also prevent infections in a study of nursing home patients. So there are now signs that these antibody drugs can also be used in a preventative way. So they're kind of acting in the way that a vaccine acts.
Well, finally, on Tuesday, CDC officials called for allowing children to return to school in person as soon as possible. What evidence are they pointing to, and what do they say local officials need to do in order to reopen schools safely?
Yeah, so I know that this has been a topic that's been on so many people's minds and so many families' minds, and it's been a really difficult debate over how to keep give students what they really need and also keep them safe. So the CDC's article that came out today in JAMA said that they found that the preponderance of available evidence, so putting everything together, despite many cases on both sides, is that they felt that they've been reassured that there hasn't been really rapid spread in schools. However, even though they recommended that there be ways to open schools safely, one thing that I think we shouldn't miss in the fine print, if you read this article, is that they said that to open schools, you really need to have other policies that interrupt transmission in the community, specifically reducing transmission in indoors, such as restricting indoor dining at restaurants. So I don't think the takeaway should be that the CDC says open schools and we don't care what you do elsewhere. I think that there is a balance to be achieved here, which is, the CDC saying that in order to open schools, there are other policies that need to be done. And on top of that, the CDC also said that in order to keep schools open, there needs to be increased physical distancing in schools, wearing masks in schools. There's a lot in there that I think is really worth sort of reading the fine print on. The CDC didn't just come out and say open schools. Their article was really a policy for guiding schools in how they can safely open.
It's such an important point. People need to read that fine print. All right, Caroline Chen. Caroline, a lot of data and information to sort through. Thank you so much for joining us.
Thanks for having me.